Milwaukee's mask mandate ends tomorrow, and the CDC just released new mask guidance. I'm joined now by Dr. Jeff Potoff from UW Health about what the new guidelines mean for all of us. Dr. Potoff, thank you for joining us once again. What do you think of the new guidance from the CDC?
You know, I think one word to kind of sum it up is it's a bit more practical in the sense that the CDC developed models that look at a number of factors, but the main one being healthcare capacity. How strained are healthcare systems? If healthcare systems are less strained, you could probably tolerate more COVID cases. They incorporate, vaccination status to look at risk, and then the normal metrics that we're used to, cases and things like that, but at a less emphasized level.
And why do you think they're focusing so much more on the healthcare system now instead of necessarily transmission and masks?
Yeah, I think with the changing landscape, percentage of people vaccinated, folks who've recently been infected, what we see is that total new cases in any given region doesn't necessarily directly link to the number of hospitalizations. In an area where a lot of people have been previously infected or are highly vaccinated, cases may be high, but they tend to be mild. They don't result in hospitalizations, and restrictions may not need to be as tight. Versus other areas that are poorly vaccinated, they may see, the same number of transmission, but, more people in hospitals, things like that. So it gives a little bit more accurate picture of what you need to do to kind of preserve those most precious resources.
And now a big conversation also is masks in schools. A lot of schools considering getting rid of their mandates. What do you think?
Yeah, I get where this is, more controversial or more thoughts going into it because, unlike the general population, we have different rates of vaccine uptake in schools. Some schools have very high rates of vaccination, especially those older kids, maybe approaching 80%. And in that scenario, those kids cohorted together closely, which would otherwise be high risk, but those high vaccination rates probably could take the masks off. Other age groups, especially the 5 to 12-year-olds, vaccinated at a much lower rate. That increases the risk a little bit. I could see where some school districts, if they have lower vaccination rates, may have some hesitancy to going mask-free.
Would you want your child to be wearing a mask in school still?
If my child was in school in a district with really high vaccination rates, and we knew that, I would be comfortable with them taking that mask off. If they were in school districts where vaccination rates are lower, I'd be a little bit hesitant. I've had this discussion with my kids, and they actually prefer to wear their mask in school. So I think some of it's, what do we as adults think? And some of it is asking our kids, what do they think?
And prior to Omicron, it seems like we were in a very similar spot to where we are now. And then things sort of went back again. Everyone started wearing masks again. Is this just sort of the cycle that we'll have every year?
I don't think we can say for sure that this cycle won't repeat where another variant comes along. But, when we look at Omicron and how contagious it was and how many people were infected, we have pretty good protection, at least for the time being. So I'm hopeful that booster doses of the vaccine can keep up with developing variants. And we get to this smoldering phase where, yeah, there's COVID. Some people we know have gotten sick from it, but we don't have these huge surges from these new variants. Not impossible that could happen, but hope we have a good run here.
Okay, Dr. Potoff, thank you.